Hi guys, my name is Bridget. I'm one of the exercise physiologists at Vector Health. Today we're going to go through how to take someone's blood pressure, which is a pretty common thing for me in my day-to-day life. We've got Brittany here, you can see her beautiful hand. She's going to be my model. So there's two ways that you can take blood pressure. The first one's manual, the second one's automatic. Manual needs to be taken by a clinician or say your doctor, and that's when you use these fancy devices. So pretty much when a clinician takes blood pressure, we pump up the pressure and it's got a little dial on the screen and we pump it up to, in most cases, 180. Sometimes we have to pump it up more, which is why it gets really, really tight and it hurts a little bit. And then we let it go really, really slowly, and we're listening for your heart sounds. So we might ask you to say, just be a little quiet for a minute while we're listening, because we're trying to really, really listen in for that sound. And we'll hear your heart go thunk, and at that point where your heart goes thunk, that's what we call your systolic blood pressure. And then we listen to it as it continually beeps and the pressure drops until eventually we don't hear it anymore. And at that point where we stop hearing it, that's what we call our diastolic blood pressure. So systolic blood pressure and diastolic blood pressure are the two top ends of your blood pressure. Your systolic is pretty much the maximum amount of pressure that's exerted by the blood against the artery walls. So it is, as I said, it's the top number, the most amount of pressure that's exerted at that time. Your diastolic's then the least amount, which is why when the pressure in the cuffs equals the systolic, we can hear it, because then the pressure of the cuff is not restricting the blood flow anymore. It equals, so the pressure through the arteries equals the cuffs, which means the blood's able to travel through and we're able to hear it. And then when we stop hearing it, it means that the pressure of the cuff is less than what's happening in the arteries, which means we can't hear it anymore. So placement of the cuff is really, really important, because the cuff only blows up in certain areas. So if I grab this and we pump it up nice and high, you'll be able to start to see where the cuff inflates in comparison to where it doesn't. Keep going. Alright, there. So as you can see here, this part of the cuff is inflated, but this part isn't. So when we line that up on somebody's arm, I won't be able to wrap it up because it's too inflated, but where the artery mark is, this big white strip, is where the most amount of pressure is, right in the center of the inflation, which means that the pressure exerted in the cuff will actually successfully block off that artery, and we'll be able to get that reading and that accurate sound. If I put the cuff over here, or if I put the cuff with this part on the front, then I'm actually not blocking off the artery at all, which means that the sounds that I hear are going to be incorrect, because the pressure will be coming from the back. Beautiful. Okay. So, on our little automatic ones, which we do use in time to time, for example, at stronger for longer classes, so that we can get more people in through quickly, we get everyone else to try and take their own blood pressures. And so that little artery marker on this specific machine is that little dot right there. So that's what we look for. So we always go slide it up. I put that thumb there because it means that it stays. Pull it nice and tight, wrap it around. Positioning is ready to go. Now, if you're getting really, really technical, there are certain ways that you should sit. So, no crossing your legs, which Brittany was just doing there. The reason for that is the crossing off your legs, again, puts that pressure, same way that the cuff will put pressure on the arteries in your arm, crossing your legs will put pressure on the veins in your leg, and then can therefore give you a faulty response. We want to try and stay with our palms sitting up so that that has nice access to the artery, because you can't really see, probably won't pick it up on camera, but if you look at someone who's really, really pale like myself, you'll see the artery that we want to look at. It goes down the side and down this part of the arm through here. So it gives the cuff nice access to that as it travels down here. No talking, because the automatic ones, they actually listen for vibrations rather than, because automatic machines can't hear, they are waiting for the pressure change and the vibrations that come back. So if you're moving around, those vibrations can give the machine a faulty reading as well. And just try and stay nice and calm. Imagine yourself on a boat or out in some daisies and sunflowers, not in a clinical testing room. Yeah, so you just press start. And the machine should do its job. So it will inflate to the same number, it'll come up, If it gets nice and high, the pressure will increase. Up to about the 180 mark, which is what we do. Brittany's a very young, healthy individual with no cardiac history, so we would inflate to about 180 with her. Sometimes if people are diagnosed with hypertension and their systolic blood pressure could be greater than 180, then the machine and myself would have to inflate higher, which means more pressure would be exerted to be able to hear when the sounds start. So there we go, we've got Brittany's blood pressure. She's within normal ranges. How are you feeling?
Good.
Good?
Yeah.
Yep, not too dizzy or anything?
No, feels good.
Cool. That's how you take blood pressure.
Oh yeah.